So I got to full dilatation last time and my baby was looking up at the stars. He was the wrong way around. What's the likelihood of that happening again?
Failure to progress in labour is the one classification or cause for caesarean section that actually lowers your chance of a vaginal delivery. But you said your baby was in the OP presentation or looking up at the stars. If this baby comes into the pelvis in the right orientation, then you would have a higher success rate of a vaginal delivery.
I've had 3 previous caesarean sections and I'm pregnant with my 4th baby and I really want a normal birth this time. The reasons for the caesarean sections were my first 2 I was induced, but I don't actually really know why. And the 3rd pregnancy I went into labour spontaneously, but my baby got into distress and so I had to have a caesarean section. So I'm just wondering what my options are.
We have no literature or no studies that look at 3 previous caesarean sections. It is not recommended, at least in the United States, that you undergo a trial of labor. With each subsequent caesarean section, the uterus does not heal as well and the scar is not as strong.
With my first birth I had a caesarean because my baby was distressed in labour. I'd just like to know what my options would be for birthing this time, whether I would have to have another caesarean or whether I could try for a labour and a natural birth.
You are one of the candidates, one of the better candidates for a trial of labour, since fetal distress does not always occur with each pregnancy. I would simply recommend that you be monitored closer during the labour to make sure that this baby tolerates labour well.
With my first pregnancy I was induced and ended up with an emergency caesarean section, and I'm just wondering what happens if I go over my due date this time, and how far over am I allowed to go, and will I be able to have an induction given that I've had a caesarean section before?
Optimally, we would like for you to go into spontaneous labour on your own. That increases your chance of a vaginal delivery. But if you do go post-dates, induction of labour is an option, although ripening of the cervix with prostaglandins, which we do, is not an option. Induction by artificially rupturing your membranes and allowing normal labour to progress is an option that's not associated with increased risk to you. Also, the use of syntocin to augment your labour is not associated with any significant increase in risk. My recommendation would be that your midwife examine you starting at about 37 to 38 weeks. If your cervix is ripe enough, a stretch and sweep be done.
My last pregnancy, which was my first one, my baby was sitting breech, so bottom down, and I was really disappointed because they wouldn't let me have a labour and birth. I had to have a caesarean section. So this time I'm hoping to get pregnant soon and I'm really hoping to have a normal birth. Can I have a labour and a birth after having an elective caesarean section without ever labouring?
Yes. You are the ideal candidate for a trial of labour after a previous caesarean section, as long as this baby also presents vertex or head first instead of breech.
I was just wondering, is there anything that I can do during my pregnancy that will maximise my chance of a labour and a vaginal birth?
Yes, there are a number of things that women can do to help them more successfully have a vaginal birth after caesarean section. Things that we certainly recommend are to watch your weight gain. And remember that weight gain is usually influenced by the fact that people put things in their mouths, which are not usually good for them. So you have to avoid a lot of carbohydrates, a lot of sugary foods, and particularly fruit juices can be problematic for increasing women's weight gain. We no longer say you must eat for 2 when you're pregnant. Small amounts are better more often than larger amounts. So the other important thing is to exercise every day. About a 20 to 30 minute walk every day is useful. We are not expecting any woman who's pregnant to start any vigorous exercise that they've never done before when they're pregnant. So rather something that you know is manageable will be beneficial. That will keep your weight gain down and will also help to maximize your chances of having a vaginal birth after a caesarean section. There are a number of other things that women can try, things like acupuncture. Some of the midwives can do acupuncture for their women, so it's something worth talking to your midwife about, but there are professionals whose business it is to actually do acupuncture, and you can make contact with them. Osteopathy is good, so that if you're having any back problems or problems with your pelvis, it may be worthwhile getting that sorted out before you actually go into labour. And there are some natural remedies that people use, but obviously the best people to consult about those things are the people who are experts or professionals with qualifications in those areas. And then, of course, there are a whole lot of recipes that people have for getting themselves into labour. There are things that the obstetricians recommend, like doing stretches and sweeps. Now, a stretch and sweep is basically where a vaginal examination is done and the cervix is stretched and the membranes are swept around to release prostaglandins, which will help you go into labour. Because the key is you don't want an induction if you've had a previous caesarean section. You want to go into labour spontaneously.